Hi, Professor. This is Cecilia Njome. At the beginning of this semester, I set several goals for myself, including deepening my understanding of psychiatric assessment and diagnosis, honing my therapeutic communication skills, and gaining confidence in formulating and implementing psychiatric treatment plans. Overall, I made significant progress towards these goals through dedicated study, active engagement in clinical experiences, and seeking feedback from my instructor, that's you, and my preceptor as well. I got a lot of feedback from the assignments I submitted. I go back, I read and follow the corrections. I also got feedback from my preceptor during my clinical rotation. While there is always room for improvement, I'm really satisfied with my achievement during this semester. Throughout my clinical experience, I encountered a range of feelings, prejudices, and biases, particularly towards mental health diagnosis or patient demographics. To manage these feelings, prejudices, and biases, I continuously reminded myself of the importance of cultural humility. I engage in self reflection and I try to identify and challenge my biases through supervision and consultation when needed. I remember one of my encounter with a Chinese patient who speak Mandarin as his primary language. I didn't understand Mandarin and I had to take care of this patient. So we resorted to using an interpreter. That even made the situation worse. And during my encounter with this patient, I think I should say I was kind of biased. Yeah, I remember I even rejected his idea of using complementary medication for his treatment. But I learned from that experience. I kind of took like a step back and reflect, like do some self reflection, and later I did acknowledge his choice of using complementary treatment, and I included that in his treatment plan. Yeah, and I kind of sought supervision and consultation when needed to help me with these feelings, biases, and prejudices. And I also remain committed to providing equitable and compassionate care to individuals. Managing my anxiety, self doubt, and uncertainty was an ongoing challenge for me during this semester. To address this situation, I utilize various coping strategies such as mindfulness techniques, seeking support from my friends, from mentors, and setting some kind of realistic goals and expectation for myself. And I also focus on incremental progress rather than perfection. Again, I recognize the value of embracing uncertainty as an inherent aspect of clinical practice, and I use it as an opportunity for learning and growth. Throughout my clinical experience, I gained a deeper understanding of the multifaceted nature of mental illness, the impact of psychosocial factors on mental health outcomes, and the importance of individualized and holistic approach to treatment. I also developed an insight into the complexities of medication management and psychiatric care, including the consideration of efficacy, safety, and patient preference. Yeah, I always make sure the patient can first, put them at the center of care, making sure they get them really involved in their care, making sure their opinion counts, respect their culture. Yeah. Reflective practice has had a profound impact on me both as a person and as a student, fostering self-awareness, enhancing critical thinking skills, and promoting continuous learning and improvement. As a future psychiatric mental health provider, it has influenced me. How do I put it? It has influenced my approach to patient care by encouraging empathy, humility, and commitment to lifelong learning. Through reflection, I have gained a deeper appreciation for the human experience of mental health illness and the significance of building trusting and collaborative therapeutic relationships. I do plan to continue using reflection in my future practice as a psychiatric mental health provider. It serves as a valuable tool for professional development, allowing me to critically evaluate my practice, learn from my experiences, and adapt my approach to better meet the needs of the patients. I intend to integrate reflective practices into my daily routine by regularly reviewing cases, seek feedback from my colleagues and patients, and also participating in supervision and continuous education and other activities just to ensure that I provide the highest quality care possible for my patients. Thank you.